Well, thanks for joining us once again on Switch On Network. As you know, we bring you some top quality content. So do make sure that you do like, a comment, and subscribe. Do follow us on all our various platforms. It is Switch On Network. Today, we have the distinct pleasure of introducing a young woman who's doing great things. She is a clinical psychologist, but I'll give her a chance to introduce herself.
Hi, thank you for having me on the show. And I love the set, it's lovely. So my name is Lerato Rasoaisi. I'm a clinical psychologist based in Johannesburg, originally from Vereeniging though, but I now live in Joburg. And I have two practices. One is in the south of Joburg, in Soweto, at a private hospital in Soweto, and then the other one is in the north of Johannesburg. So
there was a disclaimer there. You said from Vereeniging, so he's very proud of where you come from. So are you? There's always this discrepancy. Are you Free State or Gauteng?
Gauteng. Come on.
Okay. So again, we're speaking about clinical psychology. So to our viewers out there, we're speaking mental health. And, you know, a lot of times this is a taboo subject, especially amongst our people. And so tell us about a clinical psychologist. What exactly does that entail?
Well, as a psychologist, what we do, our job is about human behavior, understanding human behavior. But when you're a clinical psychologist, you work in a hospital setup. You work in a medical hospital clinical setup. So we then do more. We treat, we assess, meaning we screen and look for and treat clinical acute illnesses that are mental illnesses. So that's why we're in the hospital, because we are treating acute, meaning quite sick people in terms of their mental health, or their mental illness.
So, I mean, we know, like the psychologists, we speak about lying on the couch and pouring your heart out. That's not what you do.
That's exactly what I do.
That is what you do.
Yes. So in the hospital, I would be seeing, so if I'm going into the ward, so, you know, some people might be, they might know about the fact that you can go and get admitted in a wellness center or psychiatric hospital. So that's when I would be in the ward and then seeing people there and doing groups and doing individual sessions. And then in my office, in the rooms, you know, they say in the rooms, that's where I have my couch. Yes, in the rooms, that's where I have my couch. And then that's where outpatients come to see me. So you, for instance, if you're inside the hospital, when you get discharged, you can come to my rooms. But even if you've never been discharged, that's where you can like come and see a psychologist because you've been divorced or, you know, whatever issue that brings you there. Okay,
so you mentioned mental illness. So there's obviously the play on words, mental health and mental illness. Is there a distinction, and maybe just speak to us a bit about that? How do you distinguish between the two?
So basically, mental health is wellness. It's when you're well, when you are okay, when you're balanced. So on a day-to-day, we go to school, we go to work, we're married, we have babies, whatnot, right? We're fine. So you might, you know, have a breakup, you might lose your puppy, whatever. And then you're sad, right? For 5 days, even for 2 weeks or a month, you're sad. But you're managing, you're okay. You're still fine. You're still going to work, you're still going to school, you're still able to function. Exactly. But when you've got a mental illness, now you've got a diagnosis. And when I say diagnosis, what I mean is that how we categorize or clarify that is that your functioning, and we've got pillars of functioning, are hindered. Basically, you're not functional. So either in your social sphere, so your relationships are suffering, work, so you're not able to work efficiently or effectively. And then you're not interpersonal, you're intrapersonal. So meaning inside of you. Is affected. So you're not able to regulate your emotions, you know, you're sleeping all the time and things like that. And then your finances as well. So it impacts all the pillars of your life. So you're not functional. That's how we diagnose you with any mental illness.
Okay, so let's go to us as a society. Is mental health something that is taken seriously? Is it, you know, like I said earlier, it's a bit of a taboo subject, especially amongst our people. And so, what would you like to see change in terms of the understanding around mental health and mental illness?
Ooh. I think, you know why I took a side? Because a lot of the time we speak about awareness and creating awareness.
Yeah.
But the thing about mental illness is that no matter how much we talk about it, there's this thing that like makes people feel shameful about having it, right? And you'd be surprised how many medical doctors, how many psychologists, how many very educated people will get a diagnosis and still feel shame.
Okay.
So no matter how aware they are that there's something called depression and there's medication, there's therapy, it's a hard thing. So, but essentially it's understanding, I think also from a very young age, if we can teach children and society, if we can make it normal to cry, to be angry, to feel sad. If I talk about anger, I think about males. They often, like, if a male is angry or if a man is angry, it's like, you know, you're doing something bad. Or even if a woman is angry, it's like, no, you must be a lady. Anger is normal. It's an emotion. You're supposed to feel it and then you get through it and over it, right? So I think normalizing emotions, normalizing the expression of emotions, normalizing emotions that seem a bit like scary, you know, like rage. If someone is enraged and they break a glass, that's okay. They're expressing their emotions as long as they're not breaking someone.
So would you, from what you're telling me, does mental illness come from suppressed emotion? Is
Partly,
a big part of it, I guess.
A big part of it, yes. A big part of, not the only thing, you know, because you've got genetics as well that can predispose you. You've got trauma. So trauma, you might have someone who's healthy, who's been fine most of their life, and then they get into a very traumatic they have a traumatic experience in their life, and then they can be. So it's not just repressed stuff, you know, it's different types of incidences or factors that might lead to one being diagnosed with a mental illness.
Now we speak of mental health in a high pressure environment in general. I mean, obviously we all have jobs and we have to perform at a certain level. How big a role does that play, the environment that you constantly find yourself in? Yeah,
sure. That's a big one. So in my practice in the North, I mean, both in the South and the North, it's just that my patients present differently in different the areas. But in the North, I obviously treat a lot of like high functioning individuals, like, you know, someone who's a lawyer, who's a CA, who's a CEO of a company, who's got like quite high profile people. And I mean, obviously they work in very like demanding jobs with high stress levels. Bankers are, their lifestyle is hectic because for them, the stakes are very high. So they work in environments where there's no room for error, you know, so their stress levels, their anxiety is very high. The substance abuse there is like very high, like cocaine, all that type of like intense drugs, not just alcohol and cigarettes type of thing, because that's how they're coping with the high demand, you know, burnout, big one.
Heavy.
Burnout, depression and anxiety, substance abuse, very big. Sleep disorders as well.
Okay, so I'm gonna get personal now because I'm a sportsman. I've been a sportsman and athlete pretty much my whole life. Again, in the sporting space, it is a high pressure environment because it's all results dependent. Is it an acceptable, like, you know, mental health and understanding it and, you know, how important the mind is? Because I've learned now in my later years that, the performing is 90% mental. And so are we doing enough in that space, in the sporting landscape, to really make sure that our athletes are, you know, at the right mindset to perform at the highest level?
I want to pose that question back to you because you're the expert in the athlete space, you know, in the sports space. Do you think?
Well, from my experience, obviously I'm long retired now. It's been a long time and I don't know specifically what advances possibly have been made. But I don't think enough was being done. And to be honest, I still work with a lot of young athletes now, and I don't think that enough is being done and that enough awareness is raised about being in the right space mentally in order to perform at your optimum. And so, I mean, that's obviously where you guys come in. And is that a space that you would go into?
Definitely. Because I'm not a big like sports person or, you know, and I don't actually I don't think I ever have treated someone who plays professional sport. So I don't have, like facts about that, but I can imagine in a lot of spaces, work, either sport or like corporate, it's just not enough awareness. I want to ask you one more question. I'm not taking over your role.
No, that's fine. We're having a discussion.
So when you are a professional athlete, is there a time where you get a talk, like workshops or a talk from a health professional or like a mental health expert that comes in to tell you about depression, anxiety, stress, and, how are you going to know if you are depressed?
No, in my experience.
In your experience, no.
No, I've
Okay.
never been a part of anything like that.
Then that should answer the question, because
Okay.
it means then it's not enough, because a lot of the time the awareness stuff that I do and all my colleagues is to get out there and educate people on what mental health or mental illness is about, the two, because it's either you're healthy or you're unhealthy. So if you don't know when you are not okay, if you don't know the signs and symptoms, then you won't know.
Yeah.
You'll just think, you'll just be limping, but you won't know you
No,
have.
but then let's go deeper into that.
Okay.
So what are the signs? So if we had to, because this is an educational platform, we want
Yeah.
to educate our viewers.
Yeah.
What are the signs? Like, what are the triggers? What should you be looking for to say, actually, maybe I should have, look more or look deeper into this?
Yeah. Okay. So I'm going to talk about, I guess, the most prevalent ones. But let me start by saying, remember I said that in order to diagnose any illness, especially a mental, because we're speaking about mental health, you have to look at the spheres of functioning. Okay. So you have to look at the personal person. Are they bathing? Are they waking up in the morning? Are they, able to wake up, make their bed, do normal things, self-care? Are they going to work? Are they functional? And they social, interpersonal social sphere, is that healthy, right? So, and then also their own inside, right? Are they managing to anger management, that type of stuff? So if those four things are not intact, or one of them, or two or three, usually it's all of them that actually disintegrate, then we know there's something wrong. So there's a question mark. And then now I want to go into the prevalent ones, which is depression, anxiety and stress, substance abuse, PTSD, and which one am I forgetting? Sleep disorders and burnout. So 7, because they overlap. I'll talk about them, quickly. Just so if you're experiencing symptoms daily, weekly, so it's Monday to Monday or Monday to Sunday, and then the next Monday to Monday. Because remember, I spoke about if you lost your pet or you got divorced, you're going to be sad for a while. But you're probably going to have intermittent days where you can go out and socialize, where you actually are going to work and you're fine. And then maybe there's a weekend where your friends can't get a hold of you because you just switch off your phone because you're depressed. But it doesn't mean you're clinically depressed. It means you have a low mood, right? Yeah. So first thing, if these symptoms are ongoing, persistent, we call them persistent symptoms. So all the time you realize that, I think mostly your family members will notice it. Like, but it's been 3 months and this guy doesn't come to family gatherings anymore, So it will be the duration. And then it will be the intensity of things, right? So if so-and-so is a talkative person, but geez, in the last month, he's just super heightened. He talks all the time. He doesn't sleep. Those are signs of mania, which is bipolar. It's a mood disorder. So then it's like, sure, this thing is intense, man. Or, my sister is sad, but her sadness is more intense lately. Then, so the intensity of the thing is also an issue. And most of the time, because it's like different things, but for instance, depression, you have to have 5 of these to be able to mark it as a clinically depressed person. So I have to see low mood, lack of sleep, high appetite or low appetite, not eating and losing weight, suicidal thoughts, disinterest in the things that someone loves. Yeah. So all of those things, if there's 5 of them and they've been persistent for a specific duration and they are intense, then usually I can, tick it as this person is clinically depressed. So I think one of the things is also just like researching, like Google. I mean, a lot of clinicians, don't shoot me, they say Dr. Google is not a thing, don't do it. But I know a lot of us do that. As soon as you find a symptom, like, you're worried about something, you quickly go Google. And with stuff like mental health, the World Health Organization, it's a certified place to go look. What are the signs and symptoms of depression?
It's making sure you're going to the right platform,
yes,
obviously.
Right. So you do that. And then if you're seeing like, oh, I think maybe I've got some signs, then you go to your doctor. You go to your GP first.
What do you say to people who say, I don't have time to be depressed? Because I look at myself personally, my career ended overnight. And it was a very, very difficult moment for me because, it's all I knew. I was a professional footballer. This is how I earned a living. I still have a family to provide for. But it literally overnight, you go from earning a decent salary to literally nothing. First, you have to deal with that. And then, but at the same time, I still have to provide, so I don't have time to be depressed. What do you say to, people who say, the show must go on?
The show must go on.
You can't, there's no time for depression or any of these kind of things.
Which is most adults, most adults will tell you the show must go on. It's a tough one because the reality is that the show must go on, right? So often I'll say to my patients, we need to strike a balance. I'm not saying don't go to work. I'm not saying don't be a mom or a father to your kids, but let's see how we can take care of you while you are able to still show up as these things. So we try to strike a balance. That's a question. Well, that's the first answer I have. For instance, I would perhaps say to someone who, if you're acutely depressed, that means your functioning levels are all depleted. You can't even get out of bed. You haven't bathed for 3 days, blah, blah, blah. Then I would say, I need to admit you in a wellness institution or wellness ward. Then you can't show up. Then you have to remove yourself and get treatment and then come out. But if we can work without being an outpatient, I'll say, come see me weekly. Every Tuesday at 3, come see me. Or twice a week, come see me. That way you're getting, it's like, think about it like if you injured your foot. Either you have to go for surgery if it's acute, or there's intermediary type of treatment, like go in for a day, they do whatever they need to do.
With the injuries, it's grades. So grade 1, grade 2, grade 3.
Okay.
Yeah.
Exactly. And if it's like the least kind of like severe grade, it's like I can treat you as an outpatient, or maybe the physio can treat you. So you'll just go in for those treatments and then you go out. So that's how we would do it. Okay. And the more outpatient work is the work we can, I guess, help you show up while you're getting treatment, because you can still be home with your family at night and all of that. And then you can get resources, for instance, social work, occupational therapists. They can say, okay, how do we help you in the sphere of how do you now bounce back financially? So we work as a team, especially in the ward. How do we help you in that space? And then how does someone else help you in the other space? That type of thing.
And I think the big thing around that is there's no shame in asking for help.
Absolutely. They shouldn't be. But
unfortunately,
we live in a world where, especially in the high performance spaces, work, or, if you're a public, what do you call it? Say it? Public person, or, persona. People, who are big soccer players like you were, who they often don't want to say to someone, I'm struggling. So the shame kind of eats you up inside. And that's one of the big things with depression. It almost like it festers in shame. So if you're depressed, you're probably feeling shameful about it. Okay. And the more silent you become, the more the shame grows. And the more the shame grows, the more depressed you get. Okay. So shame is a big one. But I always say to people, whisper it to one person. Whether if you can't tell your wife, then tell I don't know, your cousin who you think knows nothing about anything. You say that, and actually that's the next point I wanted to get to, because we speak about your village. And for me personally, I know, and I have to give credit now to my wife, because my wife and my kids, I don't know what, would have happened to me, because football was my world. It was everything. And I never envisioned or saw myself doing anything else, because when you're a footballer, you think you're going to play forever. We all know it's a limited career, but when you're out there and it's actually, you're in the midst of it, it just feels like it's going to go on forever. And
when it just ends like that, you know, I was lucky because I had my wife to lean on, and you know, I had my kids to look at, and they gave me the motivation to carry on. What about, you know, the person who doesn't have that? And I've seen so many of my fellow players who, you know, after their careers ended, you know, kind of just deteriorate.
Yeah.
How important then is the village? How important is the people around you? I'm sure, I mean, they can save your life pretty much.
Oh, yeah, absolutely. Like you're saying, a village, you know, it takes a village. Nobody is an island. You can't survive as an individual alone. So, and what I want to, I don't know if I should start with, because I want to delve a little bit into what you went through, because I think a lot of soccer players probably go through it.
Like, it sounds like we're going to have a session.
Yeah, I'm avoiding taking you into a session.
It's okay. If it's going to help someone else, I'm more than happy to do it.
Exactly, right? So the thing with losing something very close to you that served as a part of your identity is very traumatizing.
Yeah.
So this could serve even with someone who's watching who was even a lawyer for most of their life, and then they retire. I see it with your 60s and above. When they retire as well, they go into like this huge depressive episode. Because all of a sudden, what used to define your identity and who you are is no longer there.
Yeah.
And, you know, it's like a rug is pulled under your feet. Like, questions like, who am I?
Yeah.
You know, what do I do when I wake up? You know, do I still go to gym, or do I take the kids to school? Which one is more important now? And that identity, it actually traumatizes you. So people can look at you and you still look okay outside, but maybe inside you're going through, like, you have a mental, maybe you're traumatized. And it might sound small, but being traumatized is a big deal. Think about, I always say to my patients, think about that ball you get at the airport, the snowball.
Okay, yeah,
right?
Snow globe.
The snow globe.
Yeah.
Right? So it's sitting there, and as soon as you turn it, and I love that ball, as soon as you turn it, it's like snow everywhere.
Yeah.
Think about it like your world is, somebody did that to your world, shakes it, and then shakes everything, and everything is like flying all around. That's what trauma is. So when someone is traumatized, it's actually not a small thing. Usually it will bring in depression, anxiety. People who are traumatized really are very anxious. You know, I'm sure you were anxious about finances. Whenever you get the school bill, you're like, oh my God, like, what is going to happen? You know? So someone who's experiencing losing their identity or their job or anything like that, or their passion, something you really love, is actually going through something serious. So we need to like pay attention to people, you know, like that. So then I want to come back to what you were saying about when you are in that stardom space, you need to make sure that you keep your village.
Yeah.
You need to, if you don't have a village, you need to create one, you know.
Yeah.
I know some of these boys are orphans. They come from like small villages and towns, you know, around the world or whatever. Then they come to Joburg, or they live in Spain now, whatever. But then they need to start creating a village, you know. I don't know, you know, it's like a therapist, or just when you go get coffee, you know, like start talking to people, but create like good friendships that are real and authentic. Someone that you know. And I say something like talk to the guy at Starbucks, because that guy doesn't know you, doesn't care, you know.
Not
it's
gonna
like,
judge you.
He's not gonna judge you. And then while you're sitting there telling them that, this week has been a tough week, they're really just gonna be present and be there. They don't look at you like, oh, you're this fancy person or whatever, right? So having those type of relationships, and nurture them, give them time. Don't say, oh, I'm this big shot. Give them time, because one day when you need them, they're going to be the people that are going to be really, really there for you, right? So I love what you pointed out, that your family was there because you also poured into them when you were up there. Yeah.
I guess now when it's not just in a sporting space, it's in life in general. And so when you look at, again, we speak about the signs and we speak about your village. What's your first course of action when you realize as an individual, I need help, or maybe your village recognizes you're not altogether okay? How do you go about it? Like, what's your first port of action in terms of actually seeking and getting the help you need?
Yeah. Okay. So, I mean, in our day and age, you can go to Google quickly and Google psychologist in my area. Literally.
Okay.
That's the first thing. So you're talking about when you've identified that you're
so
now...
like we speak about the symptoms, and then now you realize I'm struggling to get out of bed. I have less energy than I'm used, I have no motivation, all the different signs that you spoke of. So once you realize that, okay, maybe I do need help, what do you do?
Okay. So very simple answer would be, Google psychologist in my area and then book an appointment and go. But not everybody is okay to see a psychologist because, like, believe it or not, people will say, no, I'm not crazy. I don't need a psychologist, And I'll be like, what do you mean you're not crazy? Like, I don't see crazy people only. I see... In fact, I don't even know when was the last time I saw someone crazy who has psychosis, who sees people we don't see.
Yeah.
Mostly I see depressed people are going through divorces and all that. And then I explain, like, psychosis is when your reality is distorted. You're seeing and hearing voices that we don't see. Depression is a mood disorder. It has to do with your mood. So then I'll educate, right? Because in a lot of people then have that, like, the stigma. So in that case, I'll say, go see a GP. Go see a GP, because a GP, it feels more... less threatening.
Okay.
So you'll sit with your GP, they'll do their assessment because they are trained to also assess for depression and for mental illness. And then the GP will say, okay, I'm going to give you a mild antidepressant. And they're usually very good with chatting and seeing what the issues are. And then they'll say, maybe after the third time you come visit them, because now you've made them your therapist, they'll say, maybe how about we try, you seeing a psychologist? And then maybe by then you've warmed up. Because, now they've kind of opened, the space. Or you could book a psychiatrist. So you can either see a GP, you can see a psychologist, or you can see a psychiatrist.
Okay, maybe just on that one, the difference and the distinction between a psychologist and a psychiatrist.
Okay, so a psychiatrist, right, is someone who prescribes medication. Okay. Right. How they are treating the mental illness. Remember, we're a team. So how they are treating the person who's got mental illness is that they're giving them medication, antidepressant, anti-anxiety medication. So they're a medical doctor who's gone through medicine, qualified, and then specialized as a psychiatrist. Whereas I'm a psychologist, so I did the whole 6-7 years, but mine is, I didn't do medicine, so I didn't do the anatomy. I specialized in psychotherapy treatment. Okay. So I specialized in, the therapy, the trauma debriefing, the, like loss, how to bereavement, how to do loss. So all those techniques of therapy. Yeah.
Awesome. So I love the fact that you say, again, the medical community or the medical fraternity, it's all intertwined and you all work together. Mm-hmm. So how do we debunk the myth around, like, because you're saying now you have to go to a GP for them to really kind of ease you into actually seeing a psychologist. If you had to say what's needed in terms of just debunking the myth that going to a psychologist means you're crazy, what are the steps we can take in just changing the narrative around that? Tough one.
Like I said earlier on, I think normalizing something is the best way to remove shame from it. Okay. Honestly, even in my own social media, what I do a lot is talk about my own personal struggles. I had postpartum depression after I had my daughter. And I was already prone to being depressed because I was already struggling with depression and anxiety before I got the child. So my doctor told me immediately, she was like, my gynae was like, postpartum is like, I was like, yeah, I'm expecting it. And because I'm a psychologist, I was also like, I got it. I spoke to my psychiatrist. He's gonna, give me meds. After 3 months, I'm going to not be breastfeeding anymore. And then, and a lot of people then have the face you have where like, what? You also struggle? It's like, yeah, it's normal. And a lot of the time, it's that moment that I love when people realize I'm also vulnerable, that a CEO can also have depression. Someone who's very smart can also have depression, because it's like, but how can't they work their way out of it, And so I think normalizing something is very important to say, it's normal, it's okay, So talking about it more, and especially having people who are seen as, I don't know, like I guess the people we idolize,
Okay.
if those people can start talking, so if
your public figures,
your public figures, and the people who were really good. I don't know if this was like true, but apparently Messi was really anxious and like apparently he had an episode during the World Cup when they were in what was the recent World Cup?
The last one is in Qatar.
I don't know if it's true, but apparently the pressure he was feeling, that he had a bit of an episode, anxiety or whatever. I was expecting you to say yay or nay, but
honestly, if it happened, we didn't hear about it.
Okay.
We just saw the performance on the field.
Okay, but that's what I heard.
Okay.
And I could imagine like it made sense because there was a lot of pressure on him.
I mean, he's carrying the weight of a nation on his shoulders, and so yes,
and
I
a
wouldn't
very
be surprised.
passionate nation. Hey?
Of course, yes, a nation that was begging for success, especially from him in particular.
Exactly.
They were demanding it almost from him.
Do you understand what I mean? So I can see how he would have been, and I don't know how old he is, but like age is also something like, does he have the tools to work with that? So back to your question, someone like him actually sitting on a podcast like this and saying, guys, this is what I went through. This is, it was hard, and this is how I dealt with it, and whatever, could do a world of a difference to people who look up to him, because then it demystifies something and it normalizes something.
How long are you practicing?
I've been practicing for almost 7 years now. And
in that time, do you think we've made strides? Have we broken ground?
Yeah. It's not enough. I don't even think, it's not enough, but I think, actually it is.
More can be done, but we are making progress.
Yes.
Okay. So I think, that's a starting point, I guess. Where would you like to see it going? I mean, if you had to do anything in the next couple of years, what's the first changes you would make? I know you said, obviously, awareness, that's the major thing. In the next 5 years, where would you like to see the notion of actually normalizing it be?
In the high performance spaces, especially corporate, because those are the people I see, corporate, any workspace. Like I see a lot of people who work for the big banks. I see a lot of people, like I said, your bankers, your advocates, lawyers, so people who work for the big fives in that industry, and then the CAs. Oh man, those people are struggling. Those people are, especially people who are employed, because when you're employed now, your livelihood and the livelihood of your kids depends on someone else. So if you're depressed because you went through a divorce and you need 2 months off work, you don't have the luxury of that.
Of course.
Because then there's paperwork and they want us to do reports. Essentially, they're protecting their money because, think about it. If my receptionist wants to go on leave for 2 months, I need to get a new one and pay both of them at the same time. So that's why they protect their money like that. So I'm getting political, but in terms of like corporate and capitalism, but that for me, that's where I'd like to see the space. Because I think a lot of people are really suffering because they need to feed their families, but they're also not okay, and there's no space for their employers to work with them. So when employers say wellness programs and we have ICAS, they must mean it. They must really create a supportive space for their employees.
So I'm going to go back to sport again. You spoke about corporate and it's a necessity. So it's almost like, big companies should have someone on staff possibly to, deal with cases that arise on a daily basis. If a football club approached you and said, we'd like to have you on our books working for us on a daily, do you think that's something that's a reality? That's something that is needed and something that, people possibly should look to? Do you think psychology has a role in the performance space, in the high performance spaces, especially for athletes? Do you think athletes would perform better if they had someone on call?
I mean, whether they'd perform better or not, I honestly can't, because I'm not a performance expert. But what I can say is that I think that is something that is needed, because look, to have someone who's already in-house and readily accessible for the players, and that they don't need to go out there and start looking. It's like, I know I can go knock at Lerato's office. She's there every day, Monday to Friday. She's at the office, you know. So that is nice, because then you don't have to have all these steps before you get help, right? Help is there, and because that just mitigates that whole thing, sitting in at home and thinking, am I really depressed or not? And maybe like Lerato does some like talks now and again, you know, and then because that's how you see, oh, maybe I am depressed. I wasn't aware that I'm depressed. So having an in-house, I think, is great, because it also, I guess, create like role differentiation, where you have your coach who pushes for performance, but then you have your Lerato who makes sure mental health-wise everybody has a space. Okay. Does that make sense?
That definitely makes sense. And I think I personally, I know I would have benefited from something like that. And my playing days, I guess, and even my latter days, where, you know, you have someone, you know, you can, when you are feeling down, you're not feeling productive in society at large. I think it plays a role. Okay. So certainly needed. This has been, again, an education for me, and I really appreciate your time. You know, where can people reach out if, you know, they want to get help or whatever the case may be? That's your camera, ma'am.
Okay. So I am on Facebook. I have a page on Facebook. It's just called Lerato Rasoaisi, clinical psychologist. And that's where you'll find all of my practice details. I was just, explaining that for our profession, we're not all over social media like that, like in terms of like socials and Instagram, whatever. But I do have that page where people can find me. So it's just called Lerato Rasoaisi, clinical psychologist. Even Google. So if you just type in Lerato Rasoaisi, clinical psychologist, then all my socials will come up there, and my details, and Google Maps, where to find me, that type of stuff.
Well, thanks for joining us once again on Switch On Network. We bring you some top quality content that is relevant in our day and age. And this month is June's Men's Mental Health Awareness Month. And we know that there's so much plaguing our men in general in society, male bravado, the stigma that's placed on men, the fact that we don't ask for help, or we're taught not to ask for help. So that's why we have in studio today a clinical psychologist, Lerato Rasoaisi. She joins us to discuss mental health in general, and we want to know what it means to be depressed, or mental health in general, mental illness, whatever the case may be. This is the discussion we're having, and we've brought in an expert to tell us more about it.